All right, so I would say let's go ahead and get started. Navi, I'm going to let you actually introduce yourself and kind of get us going here.
Okay, my name is Navi Senga. I am from Fresno, California. I am a licensed marriage and family therapist, and I'm super excited to be a part of today's webinar with Dr. Sueldo. Because of her, I am a mommy today, so I owe a lot to her, and I'm excited to dive in and talk about everything and anything fertility related.
You're so sweet. Thank you so much. And for those who may not know me, I am Dr. Carolina Sueldo, double board certified fertility specialist, and I am the founder of Ceibo Fertility Center in Fort Lauderdale, Florida. And I've been actually practicing, this year will be 10 years since I finished my fellowship training, which is kind of wild. But here we are. So, since you mentioned it, Navi, I'll just say, I had the honor of working with you and we had the pleasure of working together. And yeah, I mean, it's just so special, right? And that feeling never
Yes.
goes away. Like I had two graduations this morning and it never gets old. You love it each and every time. It's really, really special what we get to do.
Yeah. No, and I'm so thankful that our paths crossed and I had the opportunity, to work with you. And I think one of the biggest things that kind of motivated me after becoming a mom was realizing that there are so many women that struggle silently, excuse me, with their journeys to become a mom. And I was super excited to have this opportunity alongside you, Dr. Sweldo, in providing education and resources to people. Something that almost I wish I had when I was going through my journey of motherhood. Because it unfortunately it's not something that we talk about openly. So yeah, I'm so excited to be here and to be discussing things with you today.
Absolutely. And I think people underestimate the shame and the guilt that go along with infertility, which is why, even though we do a much better job, I'll say we are much better at it today than we were 10 years ago. But there's still so much silence around it, right? And there's still so
Mhm.
much taboo. So why don't we go ahead? I know you had prepared some questions for me just to kind of do a general outline. We can definitely start
Yeah.
with that. For those who are tuning in live, if you guys have any questions for us, that are sort of appropriate for this forum, please feel free to throw them in the chat and we'll be happy to answer those as well. As I said, this is your time. This is really meant to be for information, for education, and really to empower, which is sort of what I'm all about.
Yeah. So I'm gonna probably reflect a lot on my
Yeah.
journey to pose some of those questions. I think the first and foremost, I know a lot of questions that I've gotten since becoming a mom with having people reach out to me as far as guidance is at what point do you seek support or seek guidance from a fertility specialist?
Yeah. So I think there is this really big misconception. I actually probably need to do a post about this. But there's this big misconception that if you see a fertility specialist, you're automatically sort of condemned to IVF.
Hmm.
And that really, like, nothing could be further from the truth. And so if you look at what the textbooks say, we would say, one would be an age-based diagnosis. So if you're in a heterosexual relationship, you're under 35 and you've been having unprotected intercourse for a year, then you need to at least at the minimum you need an evaluation, ideally talking to a fertility specialist about moving into treatment. Now, if you're over 35, that timeline actually shortens to 6 months. So if you're having regular cycles, if there's no cause for concern, we use sort of that age-based determinant of 6 months or 12 months. Now, for many patients, they may present with actually something concerning for infertility. For example, the husband's had some sort of testicular injury growing up, or the patient herself is having irregular cycles or severely painful periods. So it sometimes, may be alarming. And so I've had patients as young as 22, 23 years old who have irregular cycles and so have no way of timing their intercourse. And so those are really not patients who should be waiting for a year. Those patients really need to be seen much sooner. Now, if you are a single parent or wanting to become a single parent, or if you're in a same-sex relationship, then you're going to need that help much sooner. And so obviously I would not recommend waiting at in that scenario.
Okay. And then are there certain tests that can be done before meeting with a fertility specialist, or are there tests that you suggest completing when you meet with a fertility specialist?
Great question. And I'm going to have a complex answer. So there are, um, for good or for bad, there are so many tests available to us today that were not available when I started practicing 10 years ago. And so, back then, we were really reliant on the patient's menstrual history. Maybe she was using an ovulation predictor kit to check for her ovulation. And so we had that information. So those things are helpful, but definitely incomplete. Now, in today's world, we have hormone testing that's available either through your primary care, through your OBGYN. There are at-home, there are at-home tests that are now available for blood, for hormone testing. And then the male semen analysis. There's now more at-home tests than I think there have been ever. And so the semen analysis, again, if you are in a heterosexual relationship, it's such an easy, non-invasive, quick way to rule out almost 50% of infertility cases. Because remember, when you look at the distribution of causes of infertility, 30% of them are male factor alone, and an additional 20% can include both male and female factor components. So really, really important to, that's one of the first things we can do. I know in certain cultures, getting the male tested can be the hardest step, but it's definitely an easy one now with all of the at-home tests that are available. If not, your local fertility clinic having a prescription from a primary care, they would be happy to perform it. And then the
Mhm.
blood testing, again, you can do that through your OB, through a primary care, or through an at-home test. I think the biggest sort of, caveat that I would give to the blood work is you want to make sure whoever you're talking to can actually interpret it. Because
Mhm.
what I have run into is that very well-intentioned providers are ordering it, or the patient's ordering it for themselves, and then they don't really know what they're looking at or how to interpret the information. So definitely you want to take the blood work as a next key component, but you want to make sure you're able to interpret those labs properly. And then I
Yeah.
would say a third piece is the pelvic imaging, right? So the female partner, what does the uterus look like? Are the fallopian tubes open? What do the ovaries look like? Do they have a good number of eggs, a low number of eggs? What is, where does she stand? What's the foundational information? Typically, that has historically been done in three separate exams. So we typically will do what's called an antral follicle count, which is a transvaginal ultrasound, typically done during the patient's menses, and that looks at sort of, I think of the ovary as a chocolate chip cookie. And so we get to see the amount of cookie and the number of chocolate chips. A second test, which would be a saline sonogram or a water ultrasound, is typically performed after the patient has stopped bleeding and is really identified to look at the amount or the inside of the uterus, so the inside of the endometrial cavity. And then lastly, the third test would be the HSG or hysterosalpingogram, which is an X-ray dye study. In California, it's typically done by an imaging center or radiologist. Here in South Florida, many of the fertility specialists are doing it, and that has to do with different state laws based on the radiation and whatnot. Um, and then more recently, what we're finding is what's called the hyphosis study. That's what I do here at Ceibo, and it's really an all-in-one. So it's ultrasound guided, it is transvaginal. We insert a catheter and we do the saline sonogram followed by the foam test, and then we also look at the uterus and the ovaries as well. So we're doing all sort of in one study. So that's a newer thing. And they've actually been doing it in Europe for a decade now, but we're now implementing it here in the United States and seems to be offering sort of a less painful and less invasive way of achieving the same information. So
Mm.
again, just to recap for those that have just joined us, we are talking about when to see a fertility specialist and then what tests may be recommended. So we started with, if you have a male partner, a semen analysis would be standard of care as a first next step. For the female partner, blood work, looking at her hormones would be really important. Depending on what hormones are ordered, is what day of the cycle the testing should be done. And then we want to look at pelvic imaging, which is what I was just speaking about. And then lastly will be genetic carrier screening. And so genetic screening is looking at diseases that we may not express, but that we may carry. And so if both partners carry the same mutation, for example, cystic fibrosis, then they may have a child that's actually affected with the disease if the child inherits both of the bad copies. So again, sort of the four components would be semen analysis if there's a male partner involved, blood work for reproductive hormones, pelvic imaging of some sort to assess uterus, fallopian tubes, and ovaries, and then lastly, the genetic screening.
Yeah, and thank you so much, Dr. Swaldo, for sharing that information because I think a lot of times we're kind of just sitting around and waiting for that initial consult appointment with the fertility specialist. So I feel like it's very good to know in that waiting period what can be done to, hopefully be proactive. I remember having my initial consultation and getting all of that information up front. And it can be very
Yeah,
overwhelming, but going
yeah,
through the process, I realized that undergoing all of those different tests and labs and exams really helps to kind of pinpoint
yes,
what treatment options are going to be best.
yes,
And
absolutely.
so maybe that's something that we can jump into next is the different treatment options that are available when you are seeking fertility
Yeah,
support.
absolutely. And for those of us who are just joining, if you want to put in the chat where you're tuning in from, just so Navi and I have an idea, we know we're working with a couple different time zones, California and Florida, probably the two most represented here tonight. But yeah, keep us posted. And just for those who are tuning in recently, this is being recorded right now. And then at the end, we'll turn off the recording and we'll address any personal or individualized questions that you guys may have. So shifting gears, let's talk about treatment. So we talked about when you may want to see a specialist. We talked about testing. You've now done the testing and kind of what's next, right? And so again, I circle back to the distribution of the causes of infertility. So about 30% of the time, we find a male factor, and this is again in a heterosexual couple. And so, if there's male factor infertility only with a normal or a female evaluation, then depending on how severe the abnormal semen analysis is, we may talk to the patient about either IUI, which is intrauterine inseminations. And it's actually very similar to a pap smear in terms of what the patient feels. We insert a speculum. We use a very, very tiny catheter to deposit the sperm up into the uterus. The goal is to maximize the number of moving sperm that are actually coming in contact with the egg that month. And so that can be done either with the patient's own natural menstrual cycle or in combination with fertility medication, depending on the case. If the male factor is more severe, we may talk to them about IVF or in vitro fertilization that actually allows us to use the ICSI procedure. ICSI stands for intracytoplasmic sperm injection. So it literally allows us to take one sperm and micro inject it directly into one egg. And so when there is a severe male factor component, that ICSI procedure within the IVF world can absolutely be of use and be helpful. And then the third case where we're talking about sort of a more absolute male factor. So think of a semen analysis where zero sperm is found, absolutely nothing. In that scenario, we may be working with our urology colleagues to talk about trying to extract sperm directly from the testicle. And if that's not possible, eventually moving into the option of donor sperm. So when we talk about male factor, from least invasive to most invasive, those would be the different treatment options. Now, in 30% of cases, we do find that there's a female factor. And we're going to have a whole conversation about that. So I'll come back to that. 20% of the time, something in both partners, and then 20% of the time is actually unexplained infertility. Now, I actually don't like unexplained. I think that's a horrible, frustrating term for patients. I prefer undiagnosed infertility. So it's, the testing available today is simply not finding whatever it is that's going on with the patient or with the couple. And so for unexplained infertility, really the first next step needs to be medicated IUI cycles. If we do Clomid alone, which, many patients want to start with something that's less invasive, but doing Clomid alone or letrozole alone, it really doesn't bump your pregnancy rate in that particular setting. So for patients who are wanting something less invasive, really we need to start with medicated IUI attempts. Now let's go back to the female factor. So the female factor can actually involve several different organs, right? We talked about the uterus. The uterus may have a structural issue to it, or pathology. Think of things like fibroids, polyps, scar tissue, maybe a structural issue of the uterus itself when the patient was born. So, those all, depending on the diagnosis, may be a surgical intervention that's required. And if the surgery is successful, then maybe the patient tries naturally or then moves into fertility treatment. For tubal factor, so let's say the patient has tubal blockage, depending on the type of blockage and depending on whether one or both tubes are affected, is really going to determine whether one, is surgery needed, yes or no? Number two, is this patient a candidate for IUI because she needs to have at least one healthy tube to be able to do inseminations? Or is this patient going to require IVF because IVF allows us to bypass the fallopian tubes? And then lastly, I'll talk about the ovaries. The ovaries can have either egg excess or egg depletion. So the egg excess would be PCOS or polycystic ovarian syndrome. This is the most common cause from a hormonal or reproductive standpoint of irregular cycles in reproductive age women. It affects about 13% of the US population. And then the other extreme, which is early depletion, and we're actually seeing more and more of that in today's world. And it's essentially like an early menopause. The technical term for it is POI or premature ovarian insufficiency. And with today's medicine, we are actually not able to generate new eggs. And so for that patient, really we're talking about hormone replacement therapy for her. So giving her the estrogen and progesterone she doesn't make, and then considering donor egg or donor embryo as for her family building journey. So that was a lot of information and a little bit complex. But maybe to summarize, you have sort of three buckets. So one would be doing timed intercourse with or without medication. The second option would be an IUI, which is again, pap smear visit, putting that sperm up into the uterus. That can also be natural cycle or medicated with fertility medication. And then the whole world of IVF, in vitro fertilization, where we're actually taking eggs, taking sperm, making embryos, and then putting those embryos back into the uterus. So that's like the 1 minute version of everything I
Mhm.
just went through.
Yeah. Yeah, no, and again, Dr. Sueldo, thank you so much. That was very informative. And I remember, my initial consultation with Central Valley, sorry, that's my OB office with Women's
Women's.
Specialty
Yeah,
Fertility
yeah,
Center. And just being so nervous, but also
yeah,
so excited, right?
yeah,
Because walking into the clinic, you think this is it. We're gonna do this one or two times and we're gonna walk out of here with a baby in our arms. And so, I was one of those that was diagnosed with unexplained infertility. Everything, all the tests, labs, everything came back normal, which almost was a relief, but also very frustrating because it was almost like I wanted an answer of like, why is this not happening for us? So
yeah.
we did start off with two timed intercourse cycles, and
Mhm.
then those were not successful. Then we switched over to medicated IUIs. And again, those we did 5 rounds of the IUIs, and those were not successful. So I think another thing that we also don't talk about enough when you are seeking fertility treatment is also the expectations
Yeah,
and also
yeah,
the disappointment that does come with failed cycles, a negative pregnancy test. And so I was one of those individuals that, went through the least invasive to the most, invasive. And we ended up we didn't think twice about it. We took out a loan and we did IVF.
Yeah. Yeah.
And I remember in my consultation with you, I made it very clear that I wanted to do a frozen transfer versus fresh. And I know that's again getting very complex because even with IVF, there's different cycles, that come with that. But again, I am very grateful to you because you made a decision and you called me and you told me to come in because we had one embryo that looked perfect. And I think, again, another thing that is very important, especially when you are seeking fertility treatment, is, the relationship that you have with your specialist. And, I had faith in you, I had trust in you. I was very stressed out that nothing was going according to plan, but that's how this journey is, right?
Goes.
Nothing
Yeah, yeah,
ever
yeah.
goes according to
Yeah.
plan.
Yeah.
And yeah, I got my miracle Mira out of that IVF cycle. But even though it all worked out for me, and I am extremely blessed, and I am forever grateful for you and all that you have done to help me to reach my goal of being a mom. I don't think I will ever forget the emotional and physical toll that the treatments did
Yeah.
have on me. Not
Yeah.
just on me, on myself, my partner, my family. I had a team of individuals behind me supporting me through this journey. So, one thing that I think is very important is how do you with your patients manage when you have a patient that has had unsuccessful cycles, or
Yeah.
they've tried different treatment methods and they have not been successful?
Yeah. Um, yeah, I mean, you touched on so many good points. I have like five things I want to say. I think one thing I want to circle back to, so I'll answer your question, but I want to just circle back to one thing. And I cannot stress enough in my years, because I came out of training very classically trained, very by the book, and, board certified and all the things and, all the things. But there are some things that you pick up with experience and over time, and I don't have the data to back it up, right? It's a sort of anecdotal thing based on experience. And I cannot stress enough to patients that finding the right clinic and specifically finding the right physician and the right team, how important that is. Like I personally am of the belief that that impacts to the point of whether you become a parent or not. And in
Mhm.
my years, I have truly seen that. And by no means am I saying I'm the perfect doctor. I am not going to be the right fit for everybody. Women's or Ceibo, they're not going to be the right fit for everybody. So, that's not what I'm saying. What I am saying is that this journey, it is so vulnerable. It is
Mhm.
so intense. It is so intimate and personal. I mean, there are so many things that go into it that really finding the right clinic, the right doctor, I cannot stress enough, how important that is. I mean, I literally last week I had a couple that I graduated and they were both crying. I was crying. It was like tears everywhere. Um, but they came to me after failing at it somewhere else and basically said, we were told our only option was a gestational carrier. We cannot afford that. That is just not within our financial means. Like we need your help. And like had they stopped there, like they would not be parents, right? You know what I'm saying? Like so to
Mhm.
me, it is mind-blowing how impactful having the right clinic and the right doctor is. And
Mhm.
not because I'm perfect. It's not about me specifically. There are many, many wonderful fertility specialists. There are many wonderful clinics, but you as the patient acknowledging, paying attention to your gut, and really listening to, am I feeling seen? Am I feeling heard? Are my questions
Mhm.
being answered? Am I going through this journey empowered? And yes, there's going to be, emotions. And yes, you're going to feel overwhelmed. And yes, it's a lot and it's frustrating and it's disappointing. But like, are you feeling cared for? Are you feeling supported? Like those things are so, so
Mhm.
important. And I just cannot stress that enough. So I needed to I needed to stay there for a moment because,
Right.
um, I do believe that is a difference for a lot of couples in this journey. So I
Right.
wanted to just share that. So So now to your question. And to your question about stress, what I think many people don't know is that the reproductive psychology literature, so there is a whole branch within the world of infertility, and we call it, reproductive psychology. And there's a whole branch and a whole body of literature and all these research studies that have been done looking at infertility, looking at the infertile patient, looking at the infertile couple, looking at IVF, looking at the impact of treatment, et cetera. And it's very well documented. Patients who have had recurrent pregnancy losses, they suffer the same symptoms of PTSD that a war veteran does coming home from war. A patient going through IVF, they have the same cortisol levels, the same stress levels as someone going through chemotherapy or radiation for cancer treatment. So,
Mhm.
the impact and the emotional toll that being diagnosed with infertility and then the infertility treatment itself, the toll that all takes, has actually been well documented, and we understand it now more than we ever did. Now, there's still more work to be done, but we understand it now more than we ever did. And so my first visit with patients in my counseling at the very initial consultation is, hey, this is going to be hard. This is going to be stressful. This is a marathon, not a sprint. How are you guys going to get out in front of that? Well, what is going to be your proactive stress management plan, right? Because it's different for everyone, and this is your arena much more than mine.
Mhm.
But, is that group support? Is it online? Is it in person? Is it
Mhm.
individual therapy? Is it couples therapy? Is it yoga nidra? Is it daily meditation, journaling? Like, what is that going to be for you? Let's make sure we get out and do it now and not because by the time we need it, it's too late, right? We want to be
Mhm.
proactively managing. And I also have patients who come to me who maybe have a history of anxiety or a history of depression, and now the infertility that they're battling has sort of worsened that, but they've come
Mhm.
off of their meds because they don't want to take anything that may harm the baby, not realizing it's actually worse. So they've done those studies in pregnancy. They've looked at medicated, well-controlled patients with depression and anxiety versus unmedicated, not well-controlled. And the patients that are untreated actually do worse. Their babies do worse. So
Mhm.
they always talk about healthy mom, healthy baby. We want to be very proactive. If medication is going to help, by all means, let's do that, right?
Yep. Yeah. No, you're right. I feel like you're sharing my journey. That was me when I came in and met with you. Like I've always struggled, with depression and anxiety, and you're absolutely right. The fertility journey, it just amplifies it
Yeah.
even more,
Yeah.
because you put so much pressure on yourself to make it happen, to make it work. And then when you go through so many different cycles that have been unsuccessful, you do start to think negatively, and you start thinking like, am I ever going to become a mom? We've tried all of these different things. I actually took a break in between treatment. So after our fifth IUI failed, we decided that we just wanted to take some time, off with treatment before, jumping into IVF. And I was so glad that I did that because
Yeah.
I felt like my body, my mind just needed to
Yeah.
like reset.
Yeah.
So we took like a 6 month break. We got finances in order to figure out, because that's another thing,
Hmm.
fertility treatments,
Absolutely.
they cost money.
Yeah.
Um, and I'm fortunate that my husband and I were able to pursue that. And I know that there are couples out there that sometimes finances is what ends up,
Being the
being the
rate limiting
reason.
step. Hmm.
Right. Yeah. And it is scary, and I think going through all of the failed cycles that I had with the IUIs and with timed intercourse, it allowed me to go into IVF without any expectations. Like, it was almost like I needed that break in between treatment to say, okay, we're going to do this. We're going to see what comes out of this, and we're going to see what happens. And
Yeah.
we'll just take it one step at a time. And I vividly remember you telling me this is a marathon, not a sprint. So in
I
my
use that
mind,
a
it
lot.
was, you do, yes. And I'm glad that you're still using it, because for me, the IVF journey was, I just need to get to the next checkpoint, and then we'll figure out what we're going to
Yeah.
do.
Yeah.
And doing IVF is what allowed me to realize like I had my egg quality was low, you know, and IVF is what allowed me to realize like this is why it wasn't happening for me.
Sure.
And just that alone, even if I would have never gotten pregnant, I feel like just knowing that information would have given me some relief of like I figured out why
Right.
this isn't
Working.
happening.
Right. Right.
Right.
Right.
But
And
you're
I,
absolutely right. Like IVF, fertility treatments, whatever course of treatment you end up taking, you really do need, and I'm not just saying this because I'm a mental health professional. Like obviously, yes, I always advocate for you know, self-care and having a supportive, you know, network in your life, but I firmly do believe when you are going through something that is as stressful as this, and it does take that emotional and physical toll on you, you know, you don't need just, you know, a supportive partner in your finances.
right.
You need a good, strong support system. You need an outlet, whether it's you're meditating or you're journaling or, you know, you're running, you know, or having people in your life that, you know, can support you. I was very open with my loved ones about seeking fertility treatment and going through the IVF journey. And I think, you know, I think that is what helped me get through the journey. Like
Sure.
every time I had an unsuccessful cycle, I had friends at my door with my favorite ice cream, and we would hang out, we would watch movies, and we would, you know, regroup and
Right.
say, hey, we're going to try this again, you
Right.
know.
Right. Right.
But
And I
yes,
think,
the
one other thing that I talk a lot about is the sense of loss of control, right, over your
mhm,
body. Like
yep.
there's no number of miles you can run. There's no number of, whatever, pelvic floor therapy that can be done that is going to somehow make you fertile, right? And so there's something about, okay, I cannot control my infertility, but what can I control? Right?
Mhm,
I can control the support system that I have around me, whatever that
mhm,
looks like, because it's going to be different for everybody. I can control how I react, right? And maybe not in the moment, but maybe maybe with a little bit of time removed. Um, and I can control all of the non-medical pieces, right? And so
mhm,
so I want to pivot and I want to talk sometime about, you asked me in the beginning, what can we do before we see a fertility specialist? And so
mhm.
there's really so much that can be done from a lifestyle standpoint. And so when patients
Right.
come to me in my initial consultation, part of my inventory is, okay, what's your nutrition like in a 24-hour day? How much protein are you getting? What's your
Mhm,
consumption of caffeine, alcohol,
mhm,
any other toxin exposures, et cetera. So like nutrition as sort of this one pillar. Exercise, are you doing any strength training? Are you doing anything? Let's start there, right? And then are
mhm.
you doing any
Right.
strength training if you are? And so exercise is sort of that second pillar. And then I'll talk to them about sleep. How's your sleep? You would be amazed, especially post-COVID, I feel. I don't know what your experience has been, but post-COVID, I feel like half or more of my patients have poor sleep habits or interrupted
Mhm,
sleep or whatnot. And we know the data's out there. Night shift workers, those who have interrupted sleep, they have higher mortality, increased rates of infertility, increased rates of irregular menses, etc. And then the last piece, like how's your stress, right? And sort of what does that look like? What else is going on in your world that that could be impacting? And so there's so much that can be done from a simple lifestyle standpoint. And my business coach, she always says the simple things are usually the hardest ones to do.
mhm,
And we usually all know what we need to do, right? But having sort of the accountability around nutrition, around exercise, around sleep. So what you don't want is to get to me after 2 years of trying or three. I've had some patients who've been trying for 5 before they finally see me. And I'm like, hey, one of the things we need to talk about is weight management. Or we need to talk about how you drink 6 Cokes a day. Or we need to
mhm,
talk about, whatever. Like there's so much that can be done way in the beginning that can be so helpful. And then another thing that I have, really become a firm believer in over the last decade is all of the integrative practices that complement what I'm trying to do as a fertility specialist.
mhm,
So acupuncture, red light therapy, supplements, hyperbaric oxygen, right? Like there's so much out there now. And you don't need to see me to be able to do some of those things. Now you want to be informed. None of that is regulated. So you obviously you want to make sure, you know, whoever you're seeing or whatever you're doing, it's reputable. There's research around it. If you're doing supplements, what company you're using, because those are not FDA regulated and it's a multi-billion dollar industry here in the US. So, you know, there's some caveats to it, but I think part of those things is how do I take back some of the control, right? And
Right.
what can I do um, outside of those things that I can't change, right? And so
Right.
and there's so much around that that I think helps patients to empower themselves and thrive through the journey.
Right. Yeah. Yeah, no, and yeah, you're absolutely right. I think there is so much about this journey that yes, you do feel this sense of control, this loss of control because you want things to play out a certain way. I think there's this this high expectation of I'm going to walk in through these clinic doors and I'm going to walk out with a baby in
Yeah.
X amount of months, and
Yeah.
sometimes that's just not how it works. And I
Yeah.
think if I could go back in time and tell my younger self, hey, let's start exercising, let's start eating healthier, let's start taking some of those supplements, because maybe in 5, 10 years, it'll help with something. But again, I think, at this point where I'm at in my life, it's, you know, it means a lot being able to share this
Yeah.
knowledge.
Yeah.
And again, I know, Dr. Swaldo, one of the main reasons why I had reached out to you is, going through the journey, I realized at so many of those checkpoints, man, I wish I had done this a couple years ago, or I wish I would have made this a priority a couple years ago. I think we just assume that, like, once you start trying to get pregnant, at some point you're eventually going to get pregnant. If somebody would have told me your journey to motherhood is going to look like this, I probably would have thought, no, there's no way. Like, there's
Mm-hmm.
nothing wrong with me,
Mm-hmm.
right?
Mm-hmm.
And so yeah, no, I cannot thank you enough for using your platform and your expertise and your knowledge to be able to share the information that you have shared today. I think, again, one of the biggest things that you talked about is the clinic that you go to and your specialist. It literally is like family. Like, every time I walked through the doors at the specialty clinic in Clovis, it felt like my family was on the journey with me. Like, when I was not successful, you guys were grieving with me, and then we would kind of regroup and figure out what the next step was going to be. Um, it's just it's mind-blowing sometimes. Like, I look at my daughter Mira, and she's going to be 2 in August, but every time I look at her, it's a constant reminder of resiliency, of hope, of faith. And, like, I some days I feel like I'm still dreaming that she's here and that I'm her mom. And I am so thankful for the
You're gonna make
care,
me
the
cry.
compassion.
Don't make me cry.
No, but you're absolutely right. Like, your clinic and your specialist is what's going to help you get through this journey, and I love you for that.
Aw. Well, and
Like,
I
I'm
always
so
say,
thankful.
like, my patients are the strongest patients they're the strongest people that I know. Like, to go through, first of all, by the time you've come to us, right? Like, you've already been doing the thing for a while. Like, no
Right,
one just walks into a fertility clinic. Like, you've
right,
been through it already. And
right.
then everything you have to go through once you start working with us, right? And so just like my patients are the strongest people I know. And you
Yeah,
guys continue to inspire me. And that's what honestly keeps me motivated And frankly, when I was moving back to Florida was what inspired me to start Ceibo because I really wanted to bring the doctor-patient relationship back to the
Hmm.
forefront of medicine, you know, where in a time where medicine is really in general moving towards sort of a more corporate feel, a more sort of factory feel, et cetera. Um, I this field, this specialty, this what we get to do, it's so special, you know? And so
Hmm.
I love that that was your experience. I love that you were able to be successful. But more than that, I love that you felt supported and cared for the entire
Hmm.
time, which I think
Oh
is
yeah.
so huge. Um, and, you know, on the heels of National Infertility Awareness Week, which is sort of what brought us
Hmm.
together, um, I think that these types of conversations are the ones that need to be had, right? Because
Yep.
sharing your story, sharing, you know, education, sharing information, um, that just helps get the word out. And I think number one, patients can realize, hey, I'm not alone. I'm not the only one going through this. It's actually one in six
Hmm.
people worldwide. So if you have six girlfriends, one of you has infertility. Like that's just
Hmm.
crazy, right?
Right.
Um,
Right.
and number two is, okay, I don't need to do this alone. I don't need to do this in isolation. I don't need to do this in a silo. I can find whatever that community looks like for me, right? Everyone does it a little
Hmm.
bit differently, but I can find my community and I can learn to thrive through this journey. I have a friend, she's a fertility specialist and a fertility coach, and she talks a lot about thriving through infertility because it's a marathon, because some patients are in it for years. And life is
Hmm.
still happening through all of it, right? We're
Right.
still taking vacations, like birthdays are still happening, work is still happening. So, how do we navigate both together? So, I'm so happy that that was your experience, and I want to open it up to those who are on live. I don't know if anyone has any general education questions, or if you guys have, I kind of want to make this more interactive for you since this is your time. You took the time to be here tonight. Well, for you guys, it's still the afternoon a little bit.
Yeah.
Um, if anybody has any questions for Navi or for myself, that we would be happy to answer. And you can either unmute yourself or you can put your question in the chat, either one. And so, Navi, while we're waiting for those who are listening in, I think one question I would have for you is, what made you guys finally decide to go to IVF? Like, what was that? What tipped the scales for you?
So the crazy thing is, when I started fertility treatment, I told my husband, we are not doing IVF. I said, we don't, there's nothing wrong with us. We just have unexplained infertility. Let's just keep doing as many IUIs. I think I was at the time in the mindset of, if you keep trying to do something, eventually it'll work. But by the time we got to the fifth IUI and we kind of reviewed the statistics of, hey, you've tried this so many different times, you've tried so many different medicated cycles. I think at that point, and again, we had a tough conversation of, we really want to be parents, and what do we need to do? There are still options on the table for us. Those options have not been taken off the
Right,
table.
right,
Um, and I think going through the IUIs, it really did scare us for going into IVF, because it was kind of this thing of like, hey, if IVF doesn't work, I mean, my husband and I even talked about, if IVF doesn't work, there's adoption, there's surrogacy, there's still options on the table. At the end of the day, we just want to become parents.
hmm
And so, again, we were very fortunate that financially we were able to, you know, make IVF an option for us. It was not easy at all. I am petrified of needles. And I think that was one reason why I did not want to do
right,
IVF,
right,
is because, yes, I didn't realize until we started the process of even just how like detailed the process of IVF is. Like, your shots have to be administered at a certain time. You're going in every 2 days to your clinic. And the clinic for me was almost a 30-minute drive. So like an hour of my day was just driving to and from, the clinic. But like, you're monitoring appointments, the injections. I still to this day have all of my injections. I saved them because I'm still so in awe of like, I don't know
I did it.
how I did
Yeah.
that,
That's
but I did.
amazing. Yeah.
Yeah.
Yeah. I
I
love
had
that.
family members even helping. I'm like, all right, it's your turn to come give me a shot today. But again, it's just it's crazy. But like I said, the whole process, I kind of just was like, I'm gonna take it one step at a time. We had the egg retrieval, and I was pleased with my numbers because we had, I think I had 15 eggs retrieved, but by the end of it, and I think that's another thing we could probably spend a whole thing talking about is I can't remember what it's called, but the attrition rate.
Uh-huh. Yep.
Is that what
Yep.
it is?
Yep.
Right. And I remember like you and I having a conversation on the phone where you were like, hey, you had 15 eggs retrieved. This is great. But let's not get too excited because we still have to go through this process. And
Yep.
out of those 15 eggs retrieved, I only had two embryos. And one of those embryos was my Mira. Like,
Hmm. Hmm.
she stuck,
Oh, beautiful.
and
Beautiful.
yeah.
And I think there's two comments I want to make out of that. So one is if I had $1 for every time I heard I'm never doing IVF.
Yeah.
And what I would just say to that is two things. So the first one is that most of us grow up with the social construct of avoid pregnancy, be responsible, use protection,
Yes.
don't have a kid until
Yeah.
you're ready, right? Like all of that is like ingrained from day zero. And so you never really have to think about the other side of like, well, what happens if it doesn't work? What happens if I do have trouble getting pregnant? So most of us, when we're faced with infertility, now we're facing all of these thoughts for the very first time. So that's
Right.
number one. And number two is I also think how beautiful for you guys to keep it open to like adoption, surrogacy, or whatever the other options were, because for some people it's like, well, this is my last shot. If this IUI
Hmm.
doesn't take, this is it. Or this is my last embryo. If this doesn't take, this is it, or whatnot. And there is so much unnecessary stress and pressure that gets added because of
Hmm.
that sort of finality. And so, what I
Hmm.
would encourage patients who are maybe at that stage is okay, you're allowed to say you never want to do IVF. You're allowed to say this is the last IUI. You're allowed to say this is the last transfer, but you're also allowed to change your mind. And you're
Hmm.
also allowed to circle back and say, you know what? I know I said that, but now I actually want to revisit, what else is out there for me because there are
Right.
many other options. So those are just my two takeaways that I wanted to touch on. We do have a question that I wanted to touch on. Navi, I'll
Hmm.
have you answer your part first. Um, how is self-care and life post your fertility journey?
So Mira, my IVF miracle, she was born August 23rd of 2023, and it's been just wild. She's just like, I don't even know how to describe her, but she's wonderful. Like and it's crazy because I remember when I had her, I remember telling my husband, I'm content. This is it. Like I have her. I just wanted to be a mom. I'm a mom now. And I remember my 6 week follow up with my OBGYN. They asked the infamous question of, do you want birth control? And I was like, no, like I don't want it. My body's been through so much with going through fertility treatments. I just want my body to like regulate itself. And crazy enough, I used to hear about this happening to people. I never thought it would happen to me, but 6 months after my daughter was born, I had Mava and I conceived naturally, and I was shocked. I think for the first 3 months of my pregnancy, I was like, this is a joke, right? Like there's no way. I didn't believe it till I saw her on an ultrasound. But I know statistically that does happen in some patients, and I'm sure you've seen it too, Dr. Sweldo, where patients will go through fertility treatments and then they end
Yep.
up conceiving naturally on their own.
About 20% of the time. Yeah, it's
Yeah, so
wild. It's wild. It's
very wild.
amazing. That's
When I
amazing.
when I think of the statistics of that, of like Mira being conceived through IVF and then having Mava naturally, it's just it's crazy.
Life
I
is
I
crazy.
joke I got like a buy one get one free
Yes,
deal,
bonus
but
baby, for sure,
yeah.
for sure.
Yeah,
Um,
but life post my journey, it's been wonderful. I love being a mom. I am a mental health clinician and I work at a middle school and I love it. I am content right now with my two babies and yeah, life is good. I cannot complain.
That's so beautiful. That's so beautiful. So there was a question that came in. Dr. Sweldo, have you noticed couples are waiting until they're older to have children due to the economy, etc.? So I don't know if it's actually due to the economy, but we do know that patients are waiting until they're older. That has been, an ongoing trend, even over the last 10 to 15 years, even at the time when I was in training we were already seeing that patients were waiting a little bit longer. Um, and there's a combination of factors here. So number one, definitely they're waiting until they're older. If you think about it, life expectancy not that long ago was until about 50, 60, right? Like the retirement age of 65 is actually not that long ago that kind of became the norm. And so we definitely are seeing that line push back. In fact, I think there was just a big article that came out in the news media that for the first time in history, women in their 40s are actually having more babies than teen pregnancy. So, absolutely, I would say that is a statistic, that is a trend. And that also comes with its complications, right? Because we know the ovarian aging process, we know the biological clock, and there's really two key breakpoints. The first after age 35 and then the second after age 40 where we see the stats begin to decline dramatically so the answer is yes. I just don't know if the economy is the only reason. And then there was another question that came in, are there any risks to the mother or to the baby with IVF? And I'm so glad that this person asked this question. So technically if you're reading the literature, if you're reading the studies behind IVF and IVF babies, technically it is reported that there is a slight increase in both pregnancy complications as well as birth defects. Specifically, heart and bone tend to be the most common. Um, you know, Back when I was in training, I mean, we're talking 2008, 2009, we were still routinely doing fetal echocardiograms. So we were checking the baby's heart while in utero, if it was an IVF pregnancy due to the increased risk. That has really kind of fallen by the wayside in more recent times. Just the number of cases is so low that the number of studies you would need to do far surpasses the true frequency or the true incidence. And so, technically, my answer has to be yes, but in general, overall, I would say the answer is no. We also do see with fresh and frozen embryo transfers compared to spontaneous pregnancy, there's a slight increased risk in things like low birth weight or high birth weight, increased C-section rate, things like that. But again, those numbers are just, everything is relative. So it just depends on what we're talking about. The incidence for all of those things is so low that it would certainly not preclude me from treating a patient. And so, that is something, and I'm very conservative. If a mom has any underlying medical issues, diabetes, high blood pressure, thyroid, heart issues, today I saw somebody with an arrhythmia, etc. So all of those people I send to high risk pregnancy specialists. They're called MFMs or maternal fetal medicine doctors, to have an evaluation to get counseling around what risks may be implicated for them. But specifically for the IVF treatment, the incidence is overall very, very low. And when you compare it to natural or even IUI, I would say that the answer is similar. So I hope that answers your question. Any other questions before we turn off the recording? And then we'll allow just a few minutes in case anybody has any personal or individual questions. And believe it or not, Navi, we're actually coming up on an hour. I just looked at the time. That's insane. Wow.